I'm Alpha Phi Alpha Surgeon General, Dr. Jeffrey Sterling. This vlog is on social determinants and influencers of health and what you can do to reduce your risk to them. Let's jump right in. Well, the name sounds catchy, but I'm sure you're wondering, what are social determinants of health? Social determinants of health are the conditions in our environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. Social determinants of health have a major impact on people's well-being, health, and quality of life. Let's take a look at a few examples of social determinants of health. There's safe housing, transportation, and neighborhoods. The presence of items such as mold, cat, and other animal dander that causes allergies, insect bites, housing not up to code with exposed electrical wires, just to name one example, and many other considerations, all can cause adverse health. Imagine if you live in a community with inadequate transportation. How exactly are you to get to work to provide for your family? How promptly can you get to a hospital in the midst of a stroke or heart attack when seconds matter? What if your neighborhood is afflicted with high crime and violence, or is in the midst of chemicals? What if you live in regions affected by hurricanes or tornadoes? These considerations all impact health, and you can't provide adequate health care without taking these things into consideration. Racism, discrimination, and violence also represent social determinants and influencers of health. The impacts of racism and discrimination on health are numerous. Institutional racism results in poorer access to care, higher cost of care, and lesser quality. Racism results in lesser administration of pain medication for the same situation, all the way up to higher infant mortality rates in Black women. Blacks suffer worse healthcare outcomes, even when you control for socioeconomic status. To the extent that violence is more permissible in cultures, it also can contribute to situations ranging from child abuse, domestic violence, and to fractures, stab, and gunshot wounds. Community levels of police protection to police abuse also represent social influences of health. Let's look at education, job opportunities, and income as social determinants and influences of health. It is simply true that socioeconomic status sets the table for health. Circumstances ranging from being able to pay for medicines to understanding how to take your medicines are huge components of health. Simply put, higher levels of education and income correlate with better health. Well, there's also access to nutritious foods and physical activity opportunities. Food deserts, medical deserts, etc. These are real things in certain communities. There is a huge difference in healthy eating when you compare communities populated with fast food restaurants and those who have things like farmers markets and other vendors offering fresh fruits and vegetables. The same considerations exist for communities that have big spacious parks and multiple exercise facility options as compared to those in which it may be considered unsafe just to leave home. Polluted air and water also represent social determinants and influences of health. Environmental toxins complicate our very existence. If the air we breathe and the water we drink negatively affect our health, we really don't have much of a chance to be healthy in the long run, and it affects everything else that comes in the way in which we live our lives. Finally, there's language and literacy skills. More commonly than you think, language and literacy impact health. For many, the consideration is quite simple. Ask yourself, how can someone follow instructions if they can't read or comprehend them? Social determinants of health also contribute to wide health disparities and inequities. For example, people who don't have access to grocery stores with healthy foods are less likely to have good nutrition. That raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people that do have access to healthy foods. Just promoting healthy choices won't eliminate these and other health disparities. Instead, public health organizations and their partners in sectors like education, transportation, and housing need to take action to improve the conditions in people's environments. For now, my challenge to you is to take inventory. Ask yourself how each of these categories discussed in this vlog impact your life and place you at risk for poor health outcomes. Discuss with your family and friends what you can do to minimize your risk for these determinants and influencers impacting your health negatively. This simple step can make a world of difference over the long term, and even in emergencies when seconds matter. Look for additional content on Sphinx TV discussing steps you can take to improve your life and your health. I'm Alpha Phi Alpha Fraternity Surgeon General, Dr. Jeffrey Sterling. Thank you for watching.